There's a lot of this going on. Both sides say it's not about money, but rather policies, and patients feel like pawns. Abingdon resident Heather Reynolds became a new mom in April. She's now worried about losing her doctor after Johns Hopkins Medicine and United Healthcare warned in writing her coverage could end or be disrupted if they can't reach a contract agreement. How did that make you feel?
I'm kind of annoyed and freaking out. I mean, I was a new mom, and here I am finding out that I'm going to lose my doctor or have to pay for, out of network.
Heather says there aren't many options in Harford County, and she and her husband are planning to have another child next year. She says she feels like a pawn.
I do feel like they're using us as kind of leverage in their contract negotiation, and all the patients are kind of up in the air.
I get emotional thinking about it.
For privacy reasons, this couple does not want to be identified. They have already suffered 2 pregnancy losses. She is expecting a baby boy at the end of September. Like Heather, she got a warning that she may need to find another doctor.
I was just first of all, just in shock. I was like, wait a second. And then I'm just like, crap, we're probably going to have to find a new provider.
Negotiations have been going on for more than 7 months. Hopkins says they don't like United Healthcare's current practices. They cite excessive prior authorization requirements that delay treatment. They allege frequent treatment denials that force patients and doctors to fight for approved care. They complain about administrative burdens and delayed payments. Hopkins claims they have millions of dollars in unpaid claim money that should be going to patient care. United Healthcare issued a statement writing, "Our negotiation isn't about money." However, Johns Hopkins is requiring contractual provisions that would negatively impact members and employers, allowing them to turn patients away at their discretion.
I don't really know what to do now. Still hoping that United Healthcare and Capital Women's Care can work things out. Fingers crossed.
Adding to patients' stress and confusion is the coverage end date. Both sides agreed to extend it to August 25th, but before that happened, United Healthcare sent notice to its members the coverage end date would be August 15th. Reporting from East Baltimore, David Collins, WBAL TV 11 News.